telehealth medicine. Okay, with telehealth medicine, I promise that I will be talking about telehealth medicine today. Okay, telehealth services, as a condition of payment, you must use an interactive audio and video telecommunication system. Remember, guys, telehealth is a service where you see your patient over a video, right? Audio, video, telecommunication. The challenge here is choosing the right system, right? You have your compliance right there. So there are a lot of vendors out there that offers telehealth medicine software or practice management software for telehealth services. So that is your biggest challenge. How can you find the audio video telecommunication system? Okay, there are a lot of things that you need to consider before you even choose that system. But I tell you, telehealth services is also can generate you additional revenue in your practice, right? So this is not something that we can ignore. Now, 2017, we have to understand Medicare telehealth services, what originating sites means, distant site practitioners, the services, the payment, the billing. The reason that I always focus on Medicare, guys, because here, the truth of the matter is most of these insurance payers will tell you that they follow Medicare. So for my 13 years in this industry, I've mastered Medicare. Even if my claim is through United Healthcare, through Cigna or Aetna, and they deny my claim, and then I will appeal the claim, and they'll say, oh, but we follow Medicare. And I will tell you, I say, you know what? I know the guidelines of Medicare. If you want, I can send you the copy of the guideline. If you just master Medicare guidelines, I will tell you, everyone else follows their guidelines. Okay? So as we continue, these are just among the Medicare telehealth services. And these codes, many of the commercial payers follows this code as well. All right? So you have your smoking cessation services there. You have your face-to-face behavioral counseling for obesity, 15 minutes, G0447. So these are just among those codes that you can use and render as a telehealth service. Let's proceed to the next slide. Now, understanding the originating site, guys, and this is where it's also a little bit tricky, because not many of the providers doesn't even know this, right? Unfortunately, as I was saying, this is the guideline of Medicare, but unfortunately, most of the payers are following this guideline. So let's understand originating site, because remember, you see your patient. They're not in your office, right? This is through a video or audio video, right? So we have what we call an originating site, which is the location of an eligible Medicare beneficiary at the time of service that are furnished via a telecommunication system, okay? Now, according to their guideline, Medicare beneficiaries are eligible for telehealth services only if they are presented from an originating site located in a county outside of a Metropolitan Statistical Area, or the MSA. Now, how would you know if your patient is outside the MSA, right? The Rural Health Professional Shortage Area, or the HCPCS, is located in a rural census tract. These are actually the HRSA. They determine the HCPCS, and the Census Bureau determines the MSAs. You can access HRSA's Medicare telehealth payment eligibility analyzer to determine a potential originating site's eligibility for your Medicare telehealth payment. And here's the link. This is the link that you can use as a tool right? To determine if you can render a telehealth service to your patient. Just go here and then you enter your patient's address and it will tell you if that originating site or address is eligible for telehealth services. Okay, so I hope you followed me on that one. Now, the originating sites authorized by law are also the offices of physicians or practitioners, the hospitals, critical access hospitals, the rural health clinics, the federal qualified health centers, and the CAH or the hospital-based renal dialysis, including their satellites. Okay? Next slide. The originating sites authorized by law. I already said that. Let's go to the next one. Okay. Now, this is how you will be billing for telehealth. You submit your claims for telehealth services using the appropriate CPT or HCPCS code for the professional service along with the modifier GT, which means GT is a modifier that you use for interactive audio and video telecommunication systems, right? By coding and billing the GT modifier with a covered telehealth procedure code, you are certifying that the beneficiary was present at an eligible originating site when you furnish the telehealth service. By coding and billing the GT modifier with a covered ESRD-related service telehealth code, you are certifying that you furnish one hands-on visit per month to examine the vascular access site. So that modifier is very important. It's really imperative that you need to append a modifier GT when you are billing for the professional services for the telehealth services. Okay? Your place of service. You might wonder what would be your place of service. You are so used with 11 as office-based, right? Now, in this scenario with telehealth, for services furnished on or after January 1st of 2017, to indicate that the billed service was furnished as a telehealth service from a distant site, you have to submit claims for telehealth services using place of service 02, which means telehealth. The location where health services and health-related services are provided or received through telehealth telecommunication technology.